Hi everybody, I'm here to talk about my IUD. I got my IUD inserted on the 26th of September. I decided to go for an IUD as I am done having kids and I did not do well with hormonal birth control. So when I was transferring my care from Maine here to New Jersey, I decided to go ahead and give my final try to birth control. As in the IUD, the copper IUD, because I didn't want no hormones. I used the depot shot before. I do have a history of PCOS, polycystic ovarian syndrome, with a few of them that had to be surgically removed. So at that time, the depot shot did do well in reducing my cysts to a more manageable size, but I only had 2 shots over a 6-month period and I gained close to 60 pounds. So that wasn't doable for me. That one cyst continued to grow, but it wasn't causing any issues, so I decided not to have surgery. As far as I know, it was 10 centimeters by 10 centimeters as of the last time I had a scan, which was about 1.5 years ago, when I had to have surgery to remove my appendix, and it was seen on the CT scan at that time. So I went ahead and I scheduled the IUD placement. I went over my history with the provider. It was an attending and a resident at the time. They knew about my complicated case. They knew that my uterus doesn't sit where it's supposed to sit. It's on my left side. It's quite common, but mine tilts towards the back, so it goes straight and then dips like this. And, you know, when they were placing the IUD, they used to use forceps to keep it in place, which was, you know, painful, but not too bad. And then, you know, they went ahead and started the procedure. The resident did most of it, or tried. It seemed every step he needed confirmation from the attending, and when things switch hands, you know, you feel the pain inside and it's not pleasant. I figured where my uterus was for sure, it's like you know where it's coming from. Sometimes when you have pain, you don't know exactly where it's coming from, but since I knew they were working on my uterus, I knew that's where it was coming from. So it was like they were scraping me inside, and then there was a sudden sharp pain, which I figured that's when the IUD was opened up to stay in place. But they were a little surprised by my reaction, and it was just, you know, I stood still most of it. It was uncomfortable, and I had to breathe like if I was in labor, like slowly in through my nose and out my mouth. And, you know, that helped. And I also took 800 milligrams of Motrin before going to the appointment. But something didn't feel right. But anyway, it wasn't that bad of a pain, so I thought, you know, maybe it's going all right. I would have wished they weren't going back and forth between themselves, you know, because every time they switch, you know, from one person to the other, things move around and it's not pleasant. But anyway, she's talking about everything is going well, but she wants an ultrasound to make sure, you know, that the placement is right. The resident was like reluctant. He's like, oh, I'm sure it's in the right place because I inserted it all the way in before I released it, even though he wasn't sure he had released it, and he asked the attending to please do it. So when she went, she, you know, handled it a bit, and then she's like, well, it's already placed. Like, so when she tried to place it, she figured out, moving it around, that he had already released it, so that means he didn't know the exact moment when he did it. But he tried to save face, and it's fine, you know, we all do it every now and then. So she orders the ultrasound, but because I'm not in excruciating pain or bleeding a lot, it wasn't given priority. So it took about a week or so for me to go to the ultrasound. I thought everything was kind of all right because, I wasn't bleeding that much. I then stopped bleeding. I resumed my workouts about 3 days after the insertion. And I noticed that after I worked out, especially my legs, the cramping got really bad and I would bleed, but still it wasn't like continuous bleeding. It was just a little spot here and there. I also, when I bent over or picked something, I would feel like a little sharp pain inside, exactly where I felt the pain before. Like, I now know, even though I have 2 kids, I've been pregnant twice, this pain is different, and I know exactly where my uterus is and where the pain comes from. So it hurt, but it wasn't that bad. But at this point, I'm like, maybe something is poking me inside, because not only do I feel the pain, and then I have some blood to show for it, because a lot of people complain about pain from their IUDs, and their providers say that it's all in their head, that they can't be feeling it, and this and that. But anyway, get ultrasound done. The ultrasound shows my cyst, and it, obviously shows my uterus being out of place and all that stuff, which is part of the reason why I couldn't have vaginal births, because my labor didn't progress as it should have. So I had 2 C-sections back to back. Well, the first one didn't happen, then the second one was a year only after I had my first one, so it was too dangerous to try a vaginal post C-section, being that they were only about a year apart. But anyway, so ultrasound is done on a Friday. They call me Columbus Day because it was embedded in my uterus on the left side. Doctor is on and on talking about it. Obviously, I know what it is, as I am a nurse, even though I stay at home for now to help my kids with the transition to New Jersey. So, he couldn't tell me how bad it was. The ultrasound doesn't show very much of anything either, It just shows that on the left side, you can't see the arm of the IUD, so it's most likely embedded in the tissue. How bad it is, he doesn't know. I said, is it just a tiny bit? Is the arm completely inside the wall? He's like, well, you know how it's T-shaped, we only see one side sticking out, and the other one is like it disappeared, but it's in there. It's just, it's in the wall of in the muscle. He's like, this happened because the pressure from the cyst that you have on your left ovary, which during my visit, they were telling me it was the right, and I do have cysts on my right. They're 4 and 5 centimeters, kind of. So they're not small, but they're not large to the point where they would cause complications. But anyway, after I said, no, it's on the left, he went and rechecked his paperwork and did say, yes, it's on the left. He said that the pressure from the cyst pretty much led to what happened. Now, knowing that I had complications and stuff like this, they should have checked my anatomy. I asked if they were going to do an ultrasound prior to the insertion. They said there wasn't a need for it. I asked if they were going to check the placement after. They said there wasn't a need for it. But because they had such a hard time inserting it, they did decide to then do the ultrasound. Anyway, the insertion was painful, but nothing out of this world. So if they weren't sure that they released it at the right time, which obviously we figured out that wasn't the right time, I would have gone on and probably would continue to perforate my uterus and move into my abdominal cavity, because I have a high threshold for pain, and it's normal to have cramps with a copper IUD for a while. The increased bleeding during your period, which I haven't had one, and hopefully I have my surgery before I have my period, because I don't want to go through this more intense cramping and bleeding knowing that it's not correctly placed. And anyway, so they wanted to talk to me in person to discuss the surgery, which they at first wanted to do it next Wednesday. And then when we went over my history again, they decided they wanted somebody else to do the surgery who was more experienced and could deal with complications, as they were worried that I could end up with an hysterectomy or losing my ovaries due to my previous cyst removals, where they barely were able to save my left ovary. I am fine with losing my ovary on the left side, as I still have my right one that has never really given me that many big cysts. Never had to have surgery on that one. I could just have a cystoscopy to get rid of the IUD, but the IUD is now poking at the urine wall where the cyst is, and if I'm going to be under general anesthesia, I might as well get rid of that cyst. And sometimes I wish I could get rid of the ovary, because this is the third big cyst I've had on my left side. But because I'm young as I can be at this point, they don't want to remove my ovary unless they absolutely have to. The attending physician, as long as it's done next week on a day that she's able to go and see, she will participate in the surgery. The resident is going to watch, and this other doctor that I still have to meet with, because now I have to have a pre-op with him, and I'm waiting for the phone call to set it up. But because I'm not in pain or bleeding, they really are not in a rush anymore to get the surgery done. Even though my life is on hold right now, because I can't really do everything that I want to do. I just moved 2 or 3 months ago to New Jersey, so I'm still putting my house together. I have a lot of unpacking and organizing to do. I have a lot of weight that I still need to lose, and that's another thing. The IUD doesn't have hormones, and I'm not sure if it's because it's embedded on the wall, so it causes obviously inflammation and stuff like that. I put on like almost 10 pounds, and my abdomen is so bloated and so like bouncy, like a ball. It's just not a good look. But anyway, would I have done it again? You know, I wish there was a better way to get the IUD done, especially with complicated cases. Like, if it had been put on correctly, it wouldn't have been an issue, because if I'm doing well and it's embedded, I would have thought, you know, it would have been great if it had been in the right place, because I haven't had cramps, I barely had any bleeding. Obviously I haven't had that time of the month, so I can't say if it would increase my bleeding. I barely bleed anyway. But here I am, sometime in the next 2 weeks. I'm also going to be a godmother to my nephew, and the baptism is on the 28th. So I'm like, right, this is not the timing for me to have to go to surgery and look like a bloated mess and not be able to fit on anything, because I've got a huge belly as it is. And this is not helping with the journey that I want to pick up and start over again. So long story short, IUD was put in on the 26th, and it's probably going to come out before it's a month old. I don't know what I'm going to do. I don't know if I'm going to have my tubes tied or whatever for the birth control, just to make sure that I don't get pregnant, even though with the PCOS, the chances are very slim. But I did get pregnant naturally twice when I was younger. I don't want more kids. My husband doesn't want any more kids either. They're 12 and 11, so this wouldn't be a good time to restart. You know, we're just barely getting to do stuff that having another baby would keep us from doing, which is fine. You know, if it happens, it happens, but we sure want to do everything that we can so it doesn't happen. So I don't know what, you know, I certainly would rather have a baby than gain 100 pounds again, because I do have a very hard time losing weight. So that's not an option either. So once I go and talk to this other physician about the surgery, we will discuss about tubal ligation. Even though I'm 34, well, I'm 33, be 34 next month. But anyway, so that's my story. You know, I think the IUD is a good thing. Just make sure that before you have it done, have an ultrasound to see how things look inside, because it is pretty common for the uterus not to be, you know, perfectly where the book says it is, or be there the way it's supposed to be. Obviously, it does not interfere a lot of times with, you know, having kids or having intercourse. So the fact that you have those things does not mean that things are not out of where they should be or were before you had kids. So just do your homework. I was guilty of getting caught up in the moment and, you know, trusting that things were going to go well. Sometimes when you're in healthcare, you know, you think about all the things that you do for your patients and the things you wouldn't do, and you expect the same thing, and, you know, it didn't work out that way. But I hold no resentment. I do hate to have surgery, but it's gonna have to be done. There's really no other way to deal with it, because it would be too dangerous to do it in the office. So that's my story. Because I am home with my kids, I plan to do some videos, even though this is really not my thing. I hate to be on camera. But I feel like I need some accountability towards my weight loss journey, and I think this is a way to do it. I don't know many people here in New Jersey. I am also not a person that hangs out with a lot of people. My husband has a very demanding schedule, which is why I'm not working right now, because I would also have a very demanding schedule, and somebody's got to help the kids with this transition to living in a completely different place from where we were in Maine. So I find myself with some free time and also bored, and also quite, you know, I didn't picture myself being home again, because I was a stay-at-home mom when they were little. But it is my life now, and the IUD certainly messed things up right now for me, as I have to delay my weight loss journey due to not being able to, you know, really lift weights or anything like that. Just when I was working on building my booty, which is what I really want. I want to build my booty and disappear my abdomen, you know, without spending a lot of money, because otherwise I would have surgery. Maybe I can convince them to give me a tummy tuck and a butt implant. Well, I'm going to work on that, and I'll let you guys know how it goes. Have a good day.